Dilani Pania, I wanted to thank you for nominating me for the ALS Ice Bucket Challenge. I haven't been following this stuff on Facebook, but I'm glad you nominated me because I definitely learned something about ALS and I want to share that here. Basically, in the United States, ALS is more commonly known as Lou Gehrig's disease. It's named after the famous, probably the most famous first baseman for the New York Yankees, Lou Gehrig, who actually died of ALS very early. He was 37, and so it's more commonly known as Lou Gehrig's disease here. But ALS is Amyotrophic Lateral Sclerosis, and just to break that down, with Greek, A is absence, myo is muscle, and trophic is like nourishment. So it's absence of muscle nourishment, which leads to atrophy, of course. And it's lateral because it's the lateral part of the spinal cord which actually innervates these muscles. And sclerosis because there's a subsequent hardening after the degeneration. So that's what ALS is. The occurrence, it's about 4 in 100,000 people, and I'm definitely in support of this ALS thing. But just to put it in perspective, diabetes is about 8,300 per 100,000 people. So not saying anything for or against, just to put it into context of a very common disease. So it's about 4 in every 100,000. And it is quite debilitating. It leads to sort of weakness and muscle paralysis. And I wanted to talk about it because there's a lot of implications for oral health. As a matter of fact, primary findings can be in the mouth. And that's what I wanted to talk about because in dentistry we have an important role in facilitating diagnosis, actually, because 90% of these patients can actually have difficulty swallowing, so they may present to you with that problem. Additionally, about 90% have difficulty saying words, and I can imagine a situation where a patient might blame this problem on a denture or a prosthesis or something like that. So I think we have an important role there. And another thing is 64% of cases are related to tongue fasciculations, like tongue twitching. And so again, that's an important place where we can intervene. And of course, patients who've already been diagnosed with muscle weakness will have a lot of difficulty managing their oral health. And they may even need a carer, actually. And so there'll be a link at the bottom of this video to another video that shows carers how to manage their patients' brushing and oral hygiene and that kind of thing. But I thought it was very important, and it's certainly something that I didn't know about, so I definitely wanted to share that. Well, let's get this thing done. Okay, this is the best part. I get to nominate people. So, they're all dental people because we want to lift awareness in the dental profession. Number 5, Amy Fenton, assistant to the dean at Harvard. Number 4, my man Laji James, ADA Leadership Institute alumni. Number 3, Frank Sciano, director of Fenway Health. Number 2, Gillian Wallen, my fellow AHD and alum from ADA Institute. And number 1, Ryan Batty, class of 2000 Adelaide. What up, Ryan?